All right, so we'll go ahead and get started. I'm Tom McNair. I'm the Director for Instructional Programs. This is our second parent reopening webinar. And we don't have a lot of participants, but we had quite a few the first time around. So we're going to do a little slideshow for you. You want to go ahead, Mr. Sheehan? So on the panel today will be Mr. Matt Sheehan, the principal of the Center for Career and Technical Excellence, and Marissa Knapp from the Broome County Health Department. We also have Steve Moshak, our assistant principal, who will be helping us answer some questions. Here is what we will be talking about today. This is the agenda. A reopening plan, which will talk about our instructional day and what that looks like. We will be talking about student health, building hygiene, PPE, personal protective equipment, and building access and social distancing. So the format today is a webinar. It is a Zoom format. So it will be a question and answer. You'll see the question and answer section, and that's where you'll place your questions. We will answer the questions at the end. And you'll also note that the chat feature does not work. Mr. Sheehan can actually shut that off, I do believe. But we will make sure we get all of your questions answered. And we're going to do a little presentation now. And then, like I say, we'll answer the questions at the end. I'll turn it over to Mr. Sheehan.
So our reopening plan is pretty straightforward. We put up on our website, but to break it down in a simpler way is every student who goes to BOCES in the 9 through 12 program will attend BOCES on the days they're assigned in the home district cohort. So if your son or daughter is assigned to Monday, Tuesday, or every other day, or Monday, Thursday, they come to BOCES on those days. And then on the days they're not here, we'll be doing remote as synchronous instruction. So our teachers will open a Zoom to their classroom as they're teaching that day, and the students will be expected to participate. All of our students are in a online format of either, well, actually all of our students are using Google Classroom as their baseline for their format, and then they're using Zoom for their actual communication. And then every class will have those, and then they'll do the work assigned to them, and then they'll come in on the following day and do their hands-on work or what they need to do in their classroom. Student health. So we've adjusted our health offices. So currently in our health office, we have an isolation room. That's in case we have a student who comes up with symptoms and we need them to be sent home. They'll go to the isolation room to be monitored before they get picked up, so that they aren't with students who are just coming to the health office maybe to pick up meds, drop off a note, or something of that nature. We've been already calling families and continue to call tomorrow, but we'll be calling during this whole school year like we usually do. But right now we're trying to make sure you know how to get into your Google Classroom, get into your Zoom, so you feel like you're getting your information that you need to be able to get into your class. We will have our students doing a screener every day. There's 2 ways that will happen. All of our school districts have assured us in their assurances that the students coming on a bus will have already been screened in their system. And anyone who doesn't come on a bus will come through a separate entrance. And at that separate entrance, we'll be doing a screener with them and then doing periodic temperature checks with them. I think I've covered all of my things in student health. I'm going to move on to the next one.
So building ventilation, just our building ventilation systems have been assessed and updated to maintain proper levels of airflow and circulation throughout our buildings. We're using state-of-the-art cleaning materials and disinfectants, only those approved by New York State Education Department and the Department of Health. We work closely with our operations and maintenance staff to maintain processes to make sure high-touch surfaces, bathrooms, hallways, entrances, cafeterias, classrooms are all thoroughly cleaned, as well as outdoor areas. Our operations and maintenance staff also are keeping logs with the time and date each item is cleaned, each area is cleaned. And this is done to make sure areas are thoroughly cleaned and nothing is missed. And then there's also, in addition to our regular daily cleaning, deep clean is done each night by our 2nd and 3rd shifts.
So building access and PPE, we've made a list of essential visitors. Part of that is the outside groups would be like our school districts who come in, different organizations that work with our students, and then of course families who are coming in for appointments. For those parents who are coming, everything will be by appointment only. If we're talking about picking up a student, we're actually going to come outdoors to you with the student, have you sign out there instead of coming in the building. As for face coverings, we're expecting every student to wear a face covering whenever they're in high traffic areas or where people are constantly in, or congested areas. So like our hallways, our bathrooms, until they get to their seats in their classroom. When they're in their seats in their classroom, if they're 6 feet apart, they're going to be allowed to take their masks off. Most of our rooms are pretty large, so we'll be able to make that happen for our students. But if they're going in the hallway, you never know who's going to be around the next corner. So we want to make sure that they have their mask on and we're all being safe in those situations. It's clearly marked throughout our building too for the students. There's visual cues to let them know that. If you're curious what what we consider a face covering, and we follow the CDC guidelines. If you were to go to our reopening page, which is where you found the link for this Zoom webinar, there is a whole thing on all of our assurances and it outlines what a face covering is. We also sent letters home to everyone who attends CTE, P-Tech, New Visions, or EverTech that laid that out for you too.
So as far as signage, I just walked through the hallways and they're putting signs up as we speak. We already had so much signage to make sure that everybody, is safe and feels comfortable, but they're out there putting more on the floors as we speak. So we feel pretty comfortable with our signage. There's hand washing signs, face covering signs, social distancing signs, like I say, on the walls, on the floors, really everywhere. Our students and staff are all required and our staff's already been trained and our students will be trained using videos associated with hand washing, face covering, social distancing, and all trainings outlined by the New York State Education Department and the Department of Health recommendations. And then lastly, we really are trying to limit the traffic in our hallways, keep students in classrooms when we can, so that just to limit that mobility within our building or that movement within our building and our buildings, really, just to make sure that everybody's as safe as possible. So we're doing all of those things. So we just kind of went through a lot of different things, and we've been working through this the same as all of our school districts, working on this for months, really from the time that we shut down. We've been working on this, and obviously not an easy task. And in order to do this properly, we need the support of our local community and the Broome Health Department. And so we have a liaison who is Marissa Knapp, and she's been working closely with us and will continue to work closely with us throughout this entire process. So I'm going to turn it over to her to kind of talk about her role and what she can do, what she is doing to help us.
Hi, good evening, everyone. My name is Marissa Knapp. I'm a public health educator at the Broome County Health Department, and I am assigned to be your school liaison for all things COVID-19. So COVID-19, of course, is a new virus, but contact tracing and case investigations of communicable diseases is something that public health has done for decades. So we are very comfortable and knowledgeable about when there is a positive case and what we do from there. So if you are a student at the school, a staff member, or a community member not associated with the school, everyone gets the same type of case investigation and gets treated exactly the same as far as their case investigation goes. During someone's, whether they either tested positive or if they were a close contact to someone that tested positive, we are monitoring that person the entire time if they are issued a quarantine or an isolation. We do a very thorough investigation. So if someone is, worried that their child may have been, involved in a case, a close contact to someone that tested positive, I can promise you that we will be in touch with you. We work 7 days a week, and we are available every day, and we are investigating a case as soon as we are receiving that information. So we use a system. When the lab comes to us, we then start the investigation. We at the health department are bound by HIPAA, so we, of course, respect confidentiality and someone's personal health information. With that said, because of the way that we're working with schools and students and teachers returning to school, we wouldn't expect a student to know the names and phone numbers of every single person in their class. So with that said, this is where we would need to work with the school so we can identify anyone that we need to count as a close contact. We would never, post online your child's name that they tested positive, but we just want to be transparent and let you know that, of course, we need to work with the school so we can make sure anyone that was a close contact is issued a quarantine order. A big question we get is the contact of a contact. So let's say in this case that Mr. Sheehan has tested positive for COVID-19. And Mr. McNair was working with him and identified as a close contact. Everyone in Mr. Sheehan's family would be issued a quarantine because they're living together in the same household. And Mr. McNair, being that close contact, would be issued a quarantine order. Now, anyone in Mr. McNair's family, we wouldn't have to worry about. That's what we call a contact of a contact. So if there's someone in your child's class that tests positive, your child would then, we do the case investigation. If we determine your child needs to be placed in quarantine, that order is just for your child. So the other family members' activities would remain the same. And we are there the entire time to help you through that, provide recommendations, and that is what we're here for. With that said, of course, if your child ends up having symptoms and tests positive, we would work with you on that. We at the health department are not healthcare providers. We in public health, our rule is to make sure the public is protected from transmission of the virus. So we always encourage you to be in touch with your child's pediatrician, a healthcare provider. If they don't have a healthcare provider, then a virtual walk-in. There's several available testing sites in the area, which we will make sure, the school has that information. And both of our hospital systems, UHS and Lourdes, offer testing. Binghamton University has testing, and there's also several pharmacies that have testing as well. So we're there to help you, with those public health type questions and refer you to your primary care provider. We at the health department and public health strongly believe in masks. We know that masks help slow the spread of the virus. There's people who are asymptomatic, so that means that they may have the virus and not know it because they don't have symptoms or they have really mild symptoms. So that's why wearing the mask is so important to help lessen and slower the spread of the virus. I think the most important thing we want to make sure everyone understands is that if your child is presenting with symptoms of not feeling well, if they wake up, they have a fever, they're complaining, if anything that, makes you say, they're not their normal self today, they have a headache, a sore throat, we really would encourage you to make sure you are not sending your child to school and you are reaching out to the healthcare provider. Same thing with if your child has a test pending, so maybe they were in close contact with someone, maybe there's a reason their healthcare provider wanted them to get tested because of symptoms. It's really important that the kids stay home from school, because once they now go to school and if the test comes back positive, all of those people they were in close contact with, we would have to quarantine, and it makes our job difficult and also could expose other people to the virus. We know that the virus is primarily spread from particles from one person to another, and it's the fastest way of transmission. So that's, again, why we really stress the importance of the masks. I don't know if there's anything else you guys want me to touch on, if there's questions, but we are here, to offer support and offer help if you have questions. My contact information can be shared either, my phone number or email. I don't know if we're able to put that in the chat box or if you guys just want me to share it.
Yeah, it's up to you, Marissa, whatever you feel comfortable doing.
Sure. So I'm just going to share my office number is 607-778-2812. And like I said, we are working right now 7 days a week. I promise if you have a question, I will return your call within 24 hours, usually sooner. There's no stupid question. We're all learning. And I just want to also explain that the guidance sometimes does change. So just, bear with us at the health department and bear with the school. What we know right now might change in a couple weeks or could change tomorrow. So we just want to make sure everyone understands that, just, to be patient with us, as this is a new virus, and a lot of things are going to change with everyone going back to school. But we are here to help and offer any support that we can.
Thank you, Marissa. So, obviously, we're working very closely with Department of Health and others really to make this the safest possible environment for not only your children, but also our staff and people who enter our buildings. So we feel comfortable that we've done everything, and we'll continue to do everything that we can to make this quality education for your kids and get what they really need. So I see a couple of questions in the chat. I don't know if Matt, you're able to shut that off, or we just have
There's
anything in there.
actually, I don't know how to, I couldn't shut it off, but there's no questions in there. There's
Okay.
just hellos and they could hear us. At this
So
point, there's actually no questions in the question and answer either.
I think we must have done a pretty good job on the first parent reopening panel webinar. So if there's no questions, but let's give it just a few more minutes here, or just a minute or 30 seconds, whatever.
Yeah.
If
So
you have it,
if anyone has a question, please just put it in the question and answer section. It will pop up and then we can answer it.
Yep.
If not, like Mr. McNair said, we'll give it a couple minutes and then we'll say, have a great night.
and if you don't feel comfortable asking your question here, by all means, give us a call and we'll be happy to talk to you over the phone, whatever you need.
This is Marissa from the Health Department too. There's tons of information on the Health Department website. If you go to gobroome-county.com, it'll lead you to the Health Department webpage, and there is, tons of information from the New York State Department of Health, the Centers for Disease Control, the CDC. There's just lots of good information. I know sometimes we struggle with all the information that's out there, but this is what the Health Department uses for our guidance. So if anyone's looking for specific information, that's a great place to start.
Okay, I see a couple things in the chat. Anything in there, Matt? See.
There's two questions in the chat. So first question is, are you allowed to wear a bandana to school as a mask? According to the CDC guidance and our guidance online, that counts as a face covering as long as it covers from your nose to your bottom of your chin. That is considered a mask or a face covering for us. And the other question is the first day of EverTech students. The first day for EverTech students is going to be Monday. But again, you only come to school on the days that your district has assigned you as a cohort. So even if EverTech is your school, your home district, so Binghamton, Vestal, UE, Maine Enwell, would have assigned you a day, so that will provide you transportation. My name is Matt Sheehan. I'm the principal for the Center for Current Technical Excellence, and Mr. Tom McNair is the director for the instructional programs.
I take it that was a question.
Yes, I was answering that question live.
Did you take over Steve's job?
Yes, I took over that part.
I see one question. I didn't look at it.
Yeah, that was that one.
Okay. Okay, well, I guess if there are no other questions, again, we're here, we're available, Marissa is available. Anything you need, please get a hold of us, and we look forward to seeing your children when they're scheduled to be here, and we're going to provide them an awesome education like we always do. So have a great afternoon and enjoy your evening.
I'm going to answer a couple questions that came in while you were saying that, Mr. McNair.
Okay.
So students who will still be going to their trades here and be able to do them. The other one is so as soon as they're enrolled in a school district, it's more of a personal one, Kristen. So I'm going to respond to you that in a private text message.
Any other questions, Mr. Sheehan?
It's the only one, and I'm going to respond and take care of it, and then I think we're good to go.
All right.
Oop, I hit the wrong button there.
Have a great night, everybody. Give us a call if you need anything.